Test, 1, 2, test.
take it in here.
Good morning. Today I'd like to address two topics related to COVID-19. During the pandemic, we've learned that many factors contribute to the risk of death from COVID-19. And these factors, often referred to as underlying health conditions and sometimes referred to as comorbidities, include diabetes, asthma, cardiomyopathies, cancer, chronic kidney disease, chronic lung disease, mental health disorders, and any condition that results in a suppressed immune system. While there are no conclusive reasons for why some people end up with long COVID, in which symptoms can linger in the body for months after a negative test, we do know that many of these cases occur in people with underlying health conditions. The Department of Public Health operates 3 primary care clinics, 2 in North County and 1 in South County, serving tens of thousands of people each year. Many of them have these conditions. We know that many patients put off their regular care during the pandemic, and now many individuals are navigating new chronic illnesses as a result of COVID. As they begin to feel more comfortable re-entering the public space, our patients' care requires dedicated and targeted planning, and they must be evaluated with the understanding of COVID's impact on their health status and on their ability to access care. Given these rising needs, the Department of Public Health is working with the County Council to secure $2 million in Federal American Rescue Plan Act funds to hire contract workers to improve our care for individuals with these chronic conditions. These funds will allow us to hire nurses and other care providers to improve patient outcomes and expand public health and mental health services, specifically in North County, and reduce and relieve the underlying conditions that can be fatal when the patient then contracts COVID-19. What the pandemic has made clear is that we need to be expanding our public health services, and this is one of the best ways to prevent more sickness, death, and help end the cycle of negative health outcomes. Secondly, today I'd like to talk about opioids. Examples of opioids include the illegal drug heroin and prescription pain medications. By far the most deadly form are synthetic opioids such as illicitly produced fentanyl. The pandemic appears to have impacted the number of overdoses and deaths tied to opioids, and especially fentanyl. Opioids are a type of drug that interacts with receptors in the brain to reduce feelings of pain, and they may also cause euphoria. If ingested in large amounts, opioids can slow breathing, cause unconsciousness, and even death. There were 343 opioid-related deaths in 2021, tying the record high set in 2020. And of those deaths, 94.5% involved fentanyl. 2020 marked the first time there had been more than 300 opioid-related deaths in a single year in St. Louis County. In 2019, there were 266. The Department of Public Health is focusing its efforts to combat this crisis through prevention, treatment, and harm reduction programs. 5 years ago, St. Louis County launched its prescription drug monitoring program, which has grown to encompass a majority of the counties in the state to assist in the identification and prevention of prescription drug misuse and abuse. The state of Missouri approved a statewide prescription drug monitoring program last year, becoming the final state in the union to do so. St. Louis County has also boosted the availability of Narcan. Narcan is a medicine that can save the life of an overdose victim. All county police carry Narcan, as do many of our municipal police departments. and Narcan is also given to every detainee that leaves the Justice Center. And the Department of Public Health intends to increase the supply and distribution of Narcan in the coming months. In addition, our Department of Public Health is working with many partners on a 2-year opioid action plan to raise awareness, boost prevention services, and expand treatment to enable those in recovery to transition to stable housing, employment, and family life. The sharp increase in opioid overdoses related and the deaths as well has resulted in a 3-fold increase in the workload of the medical examiner's office. As the substance use disorder crisis continues to worsen, the death toll will continue. This opioid crisis underscores critical staffing needs in that office, as well as deficiencies in the outdated medical examiner's office building. Chronic shortages of space means that the bodies of individuals are often being stacked upon one another, and this is not a dignified way to handle bodies of loved ones. But the medical examiner's office has no other option to make room. Grieving families who come to identify a loved one share a tiny lobby with delivery drivers and anyone else entering the building, making those emotional moments that much harder for relatives. But the needs go beyond a new building. We'll need additional staff to help support the higher levels of services needed for autopsies related to these deaths and the cost of associated toxicology and other services. The medical examiner's office is currently preparing a proposal on how we can meet those needs moving forward. How that will be funded isn't yet known, but we do know that St. Louis County will receive about $45 million from the state's opioid settlement announced last month, allowing us to provide more resources in our opioid response. The state's $458 million settlement with the 3 biggest U.S. drug distribution companies and drug maker Johnson & Johnson was a result of bipartisan unity to go after those who have caused so much harm across the country. And as I said when the announcement was made, St. Louis County has cases against other defendants in the opioid industry, and we will continue our tireless pursuit for justice and accountability on behalf of our residents and those statewide impacted by the opioid epidemic. This was a major moment, but only the start. This is a public health crisis, and we must treat it as such. Thanks, and I would be happy to take any questions.
Dr. Page, regarding Cora Faith Walker, is there someone now performing her duties, and would you like to take a moment to remember her at all because she played such a big role in your administration?
So the question is about Cora Faith Walker. Well, we lost a very important and valuable member of our staff last week, and we're, everyone is very sad about that, and we're grieving along with her husband and her parents. And it was just a tragic loss for the county. We will certainly divide up our task, and moving forward, we will assign other staff members and eventually look for someone to perform those tasks, but it's going to be difficult.
The RSA board is meeting today regarding the RAMs, so they're meeting with their board. Is there any update regarding the divvying up of RAMs money and where that stands? I know you addressed it a few weeks ago that you were still working on it. Is there any progress being made in any kind of a resolution of how that's going to go, and do we expect anything to come out of the RSA meeting today along those lines?
Yeah, so the question is about the RAMS settlement and the RSA meeting today. We'll certainly talk to them after our meeting, and we've had some conversations. It just hasn't been the focus of the city or the county. We're in the middle of public hearings in St. Louis County on the ARPA funds, and we're listening to everyone in St. Louis County on how to best put those federal funds to work. And that listening process is taking a lot of our time right now. But we're focused on the ARPA funds and how to put those to work in St. Louis County, and we're going to continue to have conversations about the NFL funds and the division of those funds and how to put that to work as well.
Is there a timeline for when the public should expect something to come out regarding how that's going to work?
The question about the timeline on the NFL funds, we don't have a timeline right now, but we'll continue talking about it.
On your remarks today, regarding the opioid deaths, clearly that did not go away when we were highlighting COVID. It was obviously just as bad. Is there a tie there between opioid deaths and the COVID crisis that you can identify, or do you think that that crisis just continued to grow and our attention was just elsewhere on COVID?
So the question about the relationship between the opioid epidemic and COVID epidemic. Opioid epidemic has been here in our community for a while now. The prescription drug monitoring program and some of our other programs in the Department of Public Health was in part of the response. Opioid-related deaths related to overdoses went up from 2019 to 2020. In the beginning of 2020, March of 2020 was when we started to see COVID cases in St. Louis County. And we saw COVID cases rise during the first year of the pandemic. We do see that relationship as far as what causes that. I think there's mixed opinions in the public health world about why COVID contributed to more opioid deaths, but we know that they increased with COVID across the country. And from 2021 to from 2020 to 2021, it stayed the same. The opioid-related deaths in our community stayed the same. Some of our mitigation strategies may have helped some to stop that rise in deaths, but the bottom line is there's just too many. There's too many opioid-related deaths in our community. Fentanyl is a scourge on our country, and it's having an impact here in St. Louis County as well.
With the $45 million coming in from the opioid settlement, do you have a timeline for when that money will start arriving and when the county can start implementing uses for it?
Yeah, the timeline for the question is about the timeline of the opioid settlements, and we don't have a sharp timeline yet. We expect to see something this year, and I would not be surprised if those settlement funds come in over a period of years and not all at once. So the programming related to that will be something that's sustainable but also impactful. We hope to provide more mental health and substance abuse treatment services in St. Louis County. We hope to be able to expand the medical examiner's office because they are just overrun right now with work, unfortunately, and look at other programs related to treatment and reentry and job training.
Is there any conception of what the first, act could be with the first allotment of that money? And you described the medical examiner's office being overwhelmed. They're producing, a proposal for some kind of action to help that. What could that look like? Yeah, so our proposals will, we'll look to the Department of Public Health to design the response and recommendations on how to put those funds to work in the community. I would expect that they will talk about expanded medical examiner services, programming for expanded mental health and substance abuse treatment programs in our community, and any sort of support for reentry or job training. We'll have the details of that package, and we'll send it to the county council because those funds will have to be appropriated, so the county council will participate in the decision in how to put those funds to work.
What do you think needs to happen, Dr. Page, to try and combat these opioid deaths? What's key moving forward?
Well, there's no silver bullet to address opioid abuse. I mean, there's a lot of reasons why people go down that path. I think if you look at some of the public health guidelines, we need more treatment programs in our community. We have lived for the past 10 years in society with great access to opioids and a culture that, at least in part, supported access to pain medicines, probably too generously, looking back. In addition, our community and our country has not prioritized mental health services and substance abuse treatment programs like it should have. And we have to make a decision as a community whether or not we're going to put resources into this programming, these treatment programs, substance abuse treatment, and making this more readily available. I think not having a prescription drug monitoring program in the state of Missouri hurt us.
But that was corrected about 5 years ago. So I think it's going to come down to having our community decide that this is important to us and putting the resources where they need to be to stem the tide of deaths.
With the ME's office being so crowded, are you thinking that they need a new, larger facility, or are you thinking they can work with what they have?
Well, I'll look at the recommendation from the health department about how to change the medical examiner's office, but I expect that recommendation to call for a larger facility. They just don't have room. There's just too many opioid-related deaths in our community.
Is that the primary reason why they're so crowded?
Yes, absolutely. They're crowded because they don't have enough room. The medical examiner's office is crowded because they don't have enough room to process all of the folks that are coming through.
And Tom, if I just go back to the Rams issue on one more comment, you're talking about the public hearings on the ARPA funds. Do you expect that there will be public hearings on the use of these funds as well when that time comes?
Well, we haven't gotten there yet. It depends on what the settlement looks like and what the funds, what the county council wants to do with those funds. But I expect that we would want to hear from the community about what to do with it. Okay, thanks a lot.